Good to be connected with you once again. This is Mobile Steven, your host on Live Well Lived by Mobile Steven. My podcast focus on self-development and personal improvement topics with the occasion of incredible and amazing expert and professionals who come to the show to share their insights on topics and subjects on personal development and self-improvement. Now, if you want to be a guest on my show, right, you can mail me at mobilesteven.o@outlook.com. Then we get connected from there. Today, I have Constanza Roeder, who is the founder and CEO of the Art in Health nonprofit Arts Need Art and co-host of the podcast As for the Health of It. Hi, Constanza, welcome to the show.
Hi, I'm so excited to be here.
All right, excited to have you on the show. Constanza, I'm looking forward to your professional insight on today's show, right? So, Constanza, I want to ask you this question. What inspired the projects Art in Health and Heart Needs Heart, right? Interesting.
Yeah, it's awesome what I get to do. Do you want me to give you a little introduction to what it is and how we do it? Sure. Okay.
Right.
So this kind of really started for me when I was in high school and I was diagnosed with leukemia. And I had 130 weeks of chemotherapy. And as you can imagine, that was a really hard time. It's already hard enough being a teenager, and then you sprinkle a little cancer on top of it. And it's, there's a lot of heavy emotions and challenges that come along with that. And I was really fortunate in a lot of ways to have access to the arts as a pediatric patient in the United States. Most pediatric hospitals have activities and people coming by all the time wanting to play with you or do activity. I had access to the arts as a pediatric patient. And that was a really important part of my healing process, because when we go through traumatic experiences, it usually gets encoded in the part of the brain. They get encoded as sensorial memories, and we can't necessarily express them verbally. And so we need the arts. Like, the arts are really kind of the language of trauma expression. Like, we need them to, we need to express and get those emotions and process those memories so that we can fully heal. And music, movement, writing, visual arts, those were all a way that I healed. And I was very grateful to have access to that. And then I grew up in California, and then I moved to Texas, and I started volunteering on an adult cancer unit. And I'd never been in an adult hospital, much less an adult cancer unit. And it was very different than what I had access to. The first thing I noticed was how many people were alone. I was never alone when I was in the hospital. And so many of these people spent weeks and months at a time in the hospital and spent much of their time alone, going through the hardest time of their life. There weren't activities. The arts weren't present in any way.
That's awful.
Yeah. And I was like, this isn't right. And so I am a musician. I studied music in college. After I finished treatment, I went on to college and studied music and psychology. And I started going room to room and singing for patients. And it was incredibly transformative for the people I was able to work with, and for me to be able to give that to them. It was, it's hard to articulate. It's hard to articulate in words the impact of the arts. Like, you kind of only can express it through the arts. Anyway, that was, I did that for several years, and my patients kept asking for more. They're like, we need more of this. It's great you're here once a week, but we really need this every day. And we'd like other things too. And I was like, well, I'm going to have to work on that. And so I figured out how to start a nonprofit here in San Antonio, and learned from other organizations that are working in this space, that are working in arts and health and bringing the arts into healthcare spaces. And so then I started my nonprofit, and we started in end of November 2016. So we're just over 5 years old now. A month or so after we started, we hired our first visual artist, and we've
Wow.
just grown from there. And that's a big part of what we do as well, is creating meaningful economic opportunities for local artists, musicians, writers, creatives. Our artists are essential in our communities, and they're vastly undervalued and undercompensated and underemployed. So we value their work, and so we pay them for the work that they do, and we're proud that we're able to do that. And like during the pandemic, when everyone's gigs dried up, for many of them, we were their only paycheck, and we were really blessed to be able to keep all of our artists employed through the pandemic. That was a big goal of ours when everything was shut down. Anyway, so we bring arts to the bedside of patients, professional musicians playing people's favorite music at their bedside. We bring visual arts of all types to the bedside as well. Sometimes that turns into like window painting to help them personalize their space. We do writing and poetry as well. And we also do a lot of work with healthcare staff. So we're there for everyone that's in the healthcare environment, because everyone is connected and everyone
That's
is
right.
impacted by dealing with serious illness and death and so much hard stuff that happens in hospitals. So we do a lot to support healthcare staff as well. And it's, patients report lower pain levels, lower anxiety, lower depressive symptoms. They report that they're less lonely. And, these are interventions that impact patient outcomes, and they're non-pharmaceutical interventions that impact people's health in pretty profound ways.
Awesome. You're doing an amazing work, Constanza.
It's really fun. Like I said, it's awesome.
Great. That should be fulfilling, right? So I want us to talk about mental illness. What is your understanding, right, of mental illness?
Ooh, well, I'm not a mental health expert per se, but from what I understand, it's when um, I've never thought of like how to define mental illness.
What's your understanding?
Yeah, so like when something's going on within a person that is interrupting their having healthy relationships, having a happy and full life, that is either acute or chronic and generally needs some sort of external intervention. And mental illness can have all different types of factors, from uh, nutrition and biology and relationships and uh, financial toxicity, and there's all kinds of different uh, external and internal factors that contribute to mental illness, and we need to address the whole person when we're addressing mental illness. And throughout human history, the way that we haven't necessarily had mental health services and our mental health professionals and the way it's formalized now, but the arts and culture and our spiritual leaders kind of played that function in society for a long time. And there's an ethnologist who studies the role of arts and culture across cultures and across history. Her name's Ellen Disanayak, and she said that the arts and related activities are processes that humans use to return to psychological and social equilibrium. That when something's out of balance, it's a way that we can kind of regulate and return to balance. And a lot of mental illness, anxiety is super prevalent in the United States right now, and some of that, part of that is our nervous system is dysregulated, and so little minimal stress and stimuli will push us over the edge, so that we're in hyper arousal all the time. And the arts there's lots of ways to help regulate the nervous system, mindfulness techniques, breathing techniques, all that kind of stuff. But the arts because they're multimodal, they involve movement and sensory involvement and breath and expression and all these things. It's a really powerful way as well to regulate our nervous system, which is why in study after study we see that the arts have a pretty profound impact on something like anxiety.
Oh, great. Good to know. Constanza, what's the importance of child health? Would you like to share your insight?
Sure. Sure. I mean, I'm happy to share from an arts perspective.
Sure.
Yeah, there's lots of studies that arts engagement improves language development, improves cognition in children, improves school performance, improves mental health across their lifespan, improves social connections, all these things. And as an arts educator, I'm really passionate about equipping the next generation with the tools they need to manage the human experience, to deal with the human experience. We need expressive tools to help us do that. And unfortunately, a lot of people in the West, we kind of divide out like the talented and the untalented, and only the talented people are allowed to sing or dance or draw or anything like that. And we shame people, we shame children for drawing a dog that looks like a pig, or for not singing in tune, or for dancing off rhythm. And it's like, of course, like no one comes out of the womb with perfect artistic skills in the arts are something that we can build and develop. And we teach writing and reading in school because it's a basic, we as a society say this is a basic need in order to navigate the world. We need to be able to communicate. So with children that take a little bit longer to learn their alphabet or read, we don't tell them, oh, you're probably just not talented in this, and so like just don't read. just don't learn how to read. No, we take them and we come alongside them and we break things down a little bit slower to help them build that skill. And the same thing, we need to approach the arts in the same way, because there's parts of our brain and our minds and our implicit memories that we can't express verbally. We can't express in words because it's not connected directly to that language, the Broca center of the brain. And we need visual ways to express ourselves. We need movement. We need sound. There's this whole language that expresses a huge part of who we are, that everyone should know and have basic literacy in. Arts literacy is incredibly important, and it starts in childhood, because what happens is then they end up on my unit, on my oncology unit, for example, and they have no idea, they have no way to express the intensity of emotion that they're dealing with. You just can't, words aren't enough, and then they don't have the tools to go beyond that. And so we intervene with adults to help reintroduce them to their expression and their creativity. And it's incredibly powerful to watch them, people who are told that they weren't talented, and then they're all of a sudden like, oh, I'm an artist. This is
Right.
amazing. And then they just fall in love
Awesome.
with it, and it changes who they are. So
Awesome. Constanza, your area of expertise, right? Your arts in health project. Who are they targeted to in the hospital? Do you have a particular niche you focus on in the hospital?
sure. So we started with oncology, with cancer,
Okay.
because a lot of the patients that are admitted to hospitals dealing with cancer experience long hospital stays. So, weeks, months at a time, sometimes without going home. And the adult oncology unit is where we saw there was a lot of need. So that's where we started. But we've since branched out, and now we work with cardiac and stroke rehabilitation units. We're starting to work with veterans with serious mental illness. We're kind of serving the whole hospital wherever we're needed, and specifically targeting healthcare staff along the way, because our healthcare staff have been pretty ground into the dust over the last couple of years with COVID, and they're just tired and sad and burned out. And so we go and we play instrumental music in the background for them at their nurse's station and take requests and see any patients that they're having trouble with that day, and to make everyone happier, to make their jobs easier. And music can do that. The arts can do that.
Sure. How about this COVID-19 pandemic, right? So how do you attend to your clients? How do you attend to your patients, right?
During COVID?
During COVID, while some are at home, while some are in the hospital, how do you go about it?
Yeah, it's a great question. So in March of 2020, all outside programs were suspended in the hospital. So we were out, we couldn't be in person with patients for about 14 months.
Wow.
Yeah, we were we were not excited about that, because we knew that our patients were going to be even more isolated
That's right.
than they were before. And it just broke our hearts. But we
Wow.
redesigned all of our programs
That's
to
right.
be virtual. And so we worked with patients on Zoom. We worked with support groups that were meeting virtually. We provided, art and music for them to keep engagement up. We live streamed a lot of content, a lot of
That could be very
interactive.
demanding. Don't you think so?
Yeah, it was a lot. And we went through several pivots and iterations of
And
our virtual work.
you're going to put an extra charge, right? To your
Right.
services.
Yeah. And we have such wonderful committed sponsors and donors that that allowed us to be flexible and respond as needed during the pandemic. So, but it was really, there's good things that come out of that too, because now we have this whole virtual infrastructure, and we're able to continue to support groups around the country, and meet with patients that are in Chicago or in a different location. But then we're also able to provide a different continuum of care for our patients, where before we could only work with them when they were in the hospital, when they were admitted. We got a lot of questions from patients previously of, okay, well, what can I do when I'm home? Because they're too immunocompromised. Their immune system is too sensitive to go out to an art class or go to a concert or go engage in the arts in the community. So now they can work with our artist Hannah in the hospital, and then schedule a Zoom session with her while they're at home to keep doing the work and keep including the arts as part of their healing process. So there were good things that came out of the pandemic too.
That's right. There's always a good side.
Yes.
To every bad side, also a bad side to every good side, right? So we just learn to welcome each one that life presents to us.
Yes, ma'am.
Right. Thank you so much, Constanza Roeder, for that. And I want you to talk a bit about your podcast.
Yeah, sure. So we are passionate, and part of our vision at sorry, I'm trying to say the name of our podcast and the name of our organization at the same time. That doesn't work. At Hearts Needing Art, we believe that the arts are an essential part of being human, and they should be an essential part of the places that we treat humans, that the arts should be accessible for everyone facing life-altering health challenges, so that no one suffers alone, so that we have the tools to work to process difficult experiences. And we knew that we, as a little organization, can't go to every hospital in the country, in the world, and provide this, but there's amazing local arts groups that can do this work, and there's hospitals that could build these programs from within. So we really saw an opportunity to educate, to build a platform to educate people about the field of arts and health, to educate people that the arts are important for our health and well-being, and to feature all the amazing work that's being done in this field. And so we started a podcast called Arts for the Health of It, Arts for the Health of It. And we talk to researchers and artists and musicians and organization founders and just normal people that have healed themselves in some way through the arts. And it's so cool. I geek out about my own podcast and I go back and listen to certain episodes because I'm like, oh my gosh.
I love your audience.
Yeah,
I do.
Yeah. Well, great. Yeah. So we've been able to talk to amazing people. So it's great for anyone that's interested in learning more about how the arts impact their health. And we try to include some sort of practical application in most of our episodes. Something simple that people listening can do at home, even if they don't consider themselves an artist or they don't have a lot of art supplies. Like there's simple things that we can do to express ourselves creatively, and bring more richness and fulfillment to our lives.
Right. Wish you best of luck in your project, Constanza. Right?
Yep.
Sure. Do you have any parting word you'd like to share?
Oh, one of the biggest things that we do is we come alongside people when they're suffering. And a lot of the training that we do with our artists is how to do that. Because a lot of people don't know how, like they're afraid of saying the wrong thing or doing the wrong thing, or it's something that, we're not necessarily trained in. And so we train people just how to be present with people, to hold space for their stories without trying to fix them or change them, and just be that loving, accepting presence. And I feel like everyone in the world, everywhere in the world, that's something that we all need, and that's something that we can all give. So I would just encourage people, even when it's uncomfortable, hold space for each other and for each other's stories.
Right. Thank you for the motivation.
Yeah.
Right. You'd like to have your social media handles or your website, Euphenie?
Yeah. You can learn more about us at heartsneedart.org. And you can find us on social media at Hearts Need Art. And you can find our podcast at Arts for the Health of It as well on social media.
Sure. Sure. Wish you best of luck once again, Constanza Roeder. Thank you for your insights on today's show. I really had a great time.
Of course. Thanks for having me.
All right. Thanks for joining me, audience, on the show today. Remember, if you want to catch up with any of my missed episodes, just go online and search for Lawali Bamopalist TV on any cross promotion platforms you come across, or any search engine, right, and podcast that you come across, and you have an amazing time listening to the show. Perhaps you'd like to be a guest on the show. Connect with me through my mailbox or mobileastephen.co@outlook.com. I need you to stay safe. With all my love. Talk to you soon.